We need to have answers, and that are scripturally, spiritually valid answers so that we can stand on a foundation without apology to an Almighty God and say, God, I want to hold your hand and walk in the future.
To be a healer requires a willingness, an assumption, if you will, on the public's part, but a willingness on our part to be ethical in every single dimension of our practice, of our service.
Goodness is a generational phenomenon. And what God said to the Jews? If you keep this law, it will go well with you and your children.
From my own perspective, as somebody whose faith is very important to him, I have worried that we have not engaged the religious community in some of the serious ethical issues that are posed by the advances in this field, at least not to the degree that we need to.
My name is Diann, as you've heard, and I'm the kind of speaker that doesn't stand up by a podium. Maybe that's the athlete in me. And I like to walk around and watch people's faces, and maybe, if I'm lucky enough to recognize a colleague and a brother in Christ, to hold hands for moral support. I just want to say to you while I'm walking around, I don't call on anyone, so don't be afraid of me, okay? When I say good morning, I know there's a good afternoon slide up there, but that was to be my position. I am privileged and blessed to be here. I've got to admit, I'm a little cheated because I wanted to be in your presence to learn from you, and I don't know what I can offer you except a reflection on what it's like to try to talk to a secular world about the call on your life and what the ethic of care is about. I'm the kind of person that doesn't talk PhD bioethics. I don't have one, but I love the Lord. I believe that the art and science and ethic and the hallmark of what distinguishes excellence in our practice is this notion of the ethic of care. And you know, caring is a very difficult thing to describe as I go home to be with, because the ethic of care talks about the gift of presence. And I shared with my mother-in-law this morning that I was asking for her prayer support so I could get on the right plane, because I'm kind of on standby. And I'd ask your prayer support for that. And what I know is that your presence as a healing person in a ministry and your gift of the ethic of care to people isn't dependent on your physical presence, although a lot of people think that. So when I was speaking with her this morning, I said, you are in good hands, and believe me, I didn't mean Allstate. And you know what? She isn't a Christian, so I'd covet your prayers for her eternal life, not only her biological life. So as I ask myself to focus and put those things aside, I know that two are better than one, and hopefully I can help her balance out some of the decisions she's making. But that's the gift of presence and the ethic of care, and it's good to go home, but I do feel cheated not being in your midst. I do have some very straightforward objectives, and I happen to be from the New England area. My husband and I have just finished living on a boat for a full year. We had always said our children are married, they're delightfully grounded. We have 2 new sons in the Lord now. I refuse to be called a mother-in-law. But I take a lot of photography, and living on the boat's been a rich experience, and it's helped keep me grounded so that I can continue to minister. I don't know what you do in addition to committing yourself to Jesus Christ. But part of the way I stay grounded is, yes, I offer to pray with people, and I ask people, may I pray with you or for you? But the ethic of care is the notion of the gift of presence and the gift of yourself. Our whole job is to give the Lord a magnificent reputation in your life. And your ministry is service, and service has always been the work of the church, and we are the body of Christ. And my hope is, as I try to explicate the notion of the ethic of care, which doesn't get a lot of attention in the ethics literature, that I can present it in a just common sense kind of way. You know, you can have a string of degrees after your name and not one lick of common sense. Have you ever seen that in people? Oh, and our faith teaches us we can pray for wisdom and discernment, and I figure if it was good enough for Solomon, it must be good enough for us too. So as I talk about the notion of the ethic of care from an everyday perspective and share with you some nautical pictures, because that's part of my world, and also some of the people I've been privileged to minister to, sometimes the quotes behind me will have nothing to do with what I'm bringing up at the moment. They're just food for thought. But what matters most in healthcare is keeping the care in healthcare. The average HMO physician, the average physician has 7 minutes or less with a human being that's vulnerable. See, if you think about contractual relationships versus covenant relationships, it's a whole different mindset. And you and I need to be out there talking about what it means to have a covenant with a human being. And you know what? My students sometimes look at me like I'm totally square, and I've got 4 eyes, and I'm totally out of touch with reality. I'm so grounded that I feel really proud to know the Lord and to serve Him. Yeah, my profession is nursing, but my ministry is in terms of service to the Lord. I don't know who you are. I kind of like this slide a lot, don't you? See, I like to have fun, too. Nothing wrong with being joyful. How many of you are nurses? Would you raise your hand if you're a nurse? How many of you that have your hands up are real nurses? Now, you probably say, what does she mean by that? Let me tell you very quickly. My mother was a nurse. She wasn't a real nurse, though. She was an administrator. Okay? Oh, and my grandmother had a baccalaureate degree in nursing in 1924, and she was a psych mental health nurse, so she wasn't real either, right? When I'm talking about nursing, I'm talking about the art and the science and the ethic of care, and that is different call on your life than the ethic of cure. I'm not saying one is better than the other, but the ethic of care and the ethic of cure come into conflict around end-of-life decisions. And you and I need to know what are the distinguishing values and ethical responses when you operate out of those places. I would suggest to you, many of you are physicians. How many of you serve the Lord by being a physician? Would you raise your hands? And I know there are myriad specialties. You know, nurses are always apologizing for being nurses. They say, I'm just a nurse. In all the years I've been in nursing, 35 to be exact, I have never seen a physician say, I am only a physician. But nursing is having an identity crisis. And they don't even know sometimes what they do. And it's not the same identity crisis medicine is going through. I don't know about you, but I know what I'm called to be and called to do. And it's very hard to articulate that lots of times to students that basically look at you as if you're some kind of goody two-shoes and you come from Kansas and you're wearing red heels. The art and ethic of care is very difficult to articulate. And if you're a pastoral care person in this room, I honor you. We are all involved in the art and ethic of caring. One of my favorite quotes was written by a nurse, and wherever you see the word healer, she really said the word nurse, but I wanted to honor all of our differences here and the diversity and richness in that diversity, but I'd like you to share that quote with me. To be a healer requires a willingness, an assumption, if you will, on the public's part, but a willingness on our part to be ethical in every single dimension of our practice, of our service. And the quote goes on, it says, we enter a partnership. That's become a very fashionable word these days, partnership. Oh, and basically human experiences are such that sometimes we connect very powerfully with people and they leave a footprint on your heart forever. And other people we may not know in quite the same way, but her quote says that some of those moments are powerful, some of them are less powerful. She goes on, she says, your willingness to come alongside, which is the gift of compassion, to come alongside, often in silence. You know how many practitioners are uncomfortable with silence? See, part of the ethic of care and the gift of presence involves coming alongside and doing so in absolute silence. And a lot of people fear that. Myra Levine in her work talks about that extensively, and she says your moral responsibility and the quality of your ethical commitment to people can definitely be measured and called excellent or not. See, in a little while I'm going to ask you, what does it mean to be ethically competent? When I make rounds with medical students at Brown, I ask them, what do you think I'm looking for in you before you graduate as a physician? What do you think? Because students always try to psych you out, and they never take you seriously unless you grade them. And ethics is only 6 hours in the curriculum, and we don't give it any real power. I'll say, I'm looking for certain qualities, skills, and characteristics in you. And then I ask them, what do you think those skills, qualities, and characteristics are that are the mark of excellence in your practice as a nurse or a physician or a pastoral caregiver or a medical social worker? I can name those, and I think you can too. Oh, and then she finishes her quote and says, your excellence has a lot to do with your commitment, the art and ethic of care with people. I founded my, if you will, business in 1976. It was a consulting kind of experience and an educational forum. And I founded it on this scripture verse because it just seemed to speak to me. Whatever you do, you're accountable to the Lord. And we have nothing to be ashamed of. When they tell me at the university, you can't have a Bible study, I'll say, good, I'll have a book club. And I know one of the best books going. And students are hungry. And we're all students for life. I'm not talking about traditional students. So whatever you do, can we teach people that we're involved in a ministry, not just a profession? What do you profess? Sure, I'd ask that. And I'd try to look at it from the ethic of care, but I'd ask, do you know what it's like to be involved in a ministry? And how would we behave if everybody thought they were involved in a ministry? That is a very different mindset. That's a part of knowing that you're a healer and a part of the ethic of care. Oh, I know it's not PhD level ethics. When we talk about ethic of care, I'm just being common sense here, but there are a lot of people that have no clue, and they're dying to hear what you have to say. So I've got some questions that maybe you can carry on a lot longer after this particular short period of time we have together. I had hoped to eat with people and raise these questions in more detail. I'd ask, what does it mean to be a healer? Do you have to be in a particular profession to be a healer? Don't ever apologize for who you are. You're a healer. Tell people, hi, my name is Diann Uustal, and I'm one of the nicest nurses you will ever meet. I'm a healer. But you know what, Randy? This is a burn unit. And just about everything I do to you, sweetheart, is going to hurt. And you're not going to like me a whole lot. I like people to like me. I like people to see me as practicing the art and ethic and science of care and being a healer. There are times I have to write hospital policy to help people stay safe, if you will. Policy for that little boy who was 8 years old and burned in a way they didn't used to survive, but they do now. Just everything we did hurt him. Wrote a policy that said there were no owies in the bed. See, I told you I was common sense. It's pediatric language. I had an arrogant young person that didn't know a fudging thing about the ethic of care or what it meant to be involved in a ministry. See, no owies in the bed means if you're going to do some things to hurt a child in order to help him heal, you have to have some safe boundaries, some place where they can relax and be okay and not be afraid of you. So we said, hi, if you're in your room, it's safe haven. Our home is like that. Safe haven. And we said, if you're going to do something, you have to say, come along with me, and I'll be there for you, but a lot of things I'm going to do hurt. And I'll take you to the treatment room. I had an arrogant person who said, cut it out, I'm not going to go to the treatment room. It takes too much time, and yada, yada, yada. And just breaking down trust immediately. The ethic of care has to do with keeping promises. And one of our promises was, yes, in order to help you heal, we're going to hurt, but guess what? We're not going to hurt you in this environment over here. We'll take you over here. See, I just want to talk everyday ethics. And I want to introduce to you some people in my life. What's involved in healing relationships? You'll be able to answer that. I like this particular quote. I know the author pretty well. Maybe it isn't as scholarly as some of the quotes you've seen, but the whole notion of a relationship and coming alongside is predicated upon, yes, presence, which we're beginning to talk about. It's predicated on a response and a commitment to serve people. The word service, go ahead, I dare you. I double dog dare you, as a matter of fact. That means I'm a 60s kid. I dare you to find the word service in the average literature. I'm not talking Christian literature. So the art and ethic of care, even though we can explicate it in very fine, noble terms, is not recognized for the power that it offers. Healers aren't passive people. We're called to be attentive. We're called to be present to people, and we're called to talk about it. We're not to be passive people. And lots of times when we minister to people, it takes a great deal of courage. See, his name is Herbert. And he had a bad heart attack. And that was his first admission, and it's a small community hospital, and you get to know people's lives. Isn't it a privilege? And his bride of 52 years, do you hear that story, narrative ethics? His bride of 52 years. Can you imagine? If my husband, after a mere 31 years of being married, would honor me and call me his bride, I'd be so excited. But he said, this is my bride of 52 years, Diann. His bride wanted everything done. Herbert told all of us, nurses, physicians, medical social workers, he said, I've had enough. We are not to be passive. I'm not going to be rude, but I couldn't get the physician to write a no CPR order. Please, I wish I could have had lunch with you, because I'd tell you how I try to talk to people about, guess what? You have no right to invade somebody's bodily privacy in the name of the ethic of care when they say no. What part of no don't we understand? See, when you're in a ministry, you know all that stuff, so it's almost not the best example to talk to you about, is it? His bride of 52 years wants everything done. Herbert says, Diann, when my time comes, let it come. See, he's dependent on my character. See, very few things in contemporary bioethics, in terms of principles, really talk about character. And whether you're the President of the United States or not, character counts. And I tell my students, leave an indelible impression. Stand for something. Be a person of integrity. Integrity just means predictability. Who I am under pressure at midnight versus who I am when I'm feeling pretty good first thing in the morning should have some internal congruence. Where do you draw your internal congruence from? That's part of what we're here to talk about. Oh, and I'd suggest to you, again, what lies in front of us and what's happened in our past is absolutely insignificant in comparison to the values and the ethics and the way in which we minister, which is part of our character and certainly part of our hallmark. Your job is to serve. And you know what? We're scared to death to talk about love in the workplace. Why can't I talk to my students about love? Oh, and have you ever noticed what we do in education? We make our students scared to death of us. If I'm modeling the ethic of care, how do I practice it? See, I pass out the final exam the first night in class. Oh, my colleagues who don't know a lot about ministry, maybe, I'm not being rude and I'm not being mean-spirited, please. They go to the dean and they say, Uustal's cheating. Look at me. Do I look like a cheater to you? I pass out the final exam first night in class because my husband and I have been married 31 years and he can't figure me out yet. I don't figure students can do it in 16 weeks. And I'm a very upfront, straight shooting person. I'll say, hi, this is what I expect. Real life is difficult. Real nursing and real medicine is difficult. And here's what I'm looking for. Excellence in your practice and a commitment to serve and a willingness to come alongside with vulnerable people. That takes time, it takes energy, and it takes character. It's all part of the ethic of care. But if they don't take you seriously, see, if you pass out the exam, you can say, oh, there may be things you're more interested in than I am. Why don't you hold yourself accountable for learning those? There are points assigned to those. You answer what you want to answer. Oh, it might sound flimsy. But you know, one of the things we all come away with is an appreciation for, number one, what our gifts are and our talents are, and how to talk about them, and how to say to people honestly, listen, I do care, even though I have a very short period of time to demonstrate that in most environments. If we don't talk about love in the workplace, and if we don't talk about promise keeping, some of you are members of Promise Keepers. Well, my mama, the nurse, she told me a long time ago, sweetheart, don't make promises you can't keep. See, the promises we make have something to do with bioethical principles and ethically relevant concepts and the notion of the ethic of care. My mom said, don't make promises you can't keep. You know, one of the promises I can't keep as a nurse is safe, patient care. Why? Because the care is being squeezed out, and there is another more important ethic, if you will, and it isn't the ethic of care. It's cost. Yes, you should be a good steward. That's part of your promises. I know that, but how many times do you see in the contemporary system the ethic of care does not trump? What are we doing about it? And how do we talk about that ethic? What are our special obligations from an ethically relevant concept? I don't know about you, but I love this quote from Schweitzer. He says, you know what? You can be joyful and really happy if you know why you're here. Oprah Winfrey says it a little differently. She says, hi, you're taking up space, sucking up air on the planet, and given that you are, what are you here for? See, some people have no clue why they're here. You do. You're in a full-time ministry, and that's part of the ethic of care, and caring is always exemplified in the gift of service. I would ask you, if we had a longer time, not just an hour, 16 weeks in an ethics course, what are those things you're willing to lay your life down for? I've never been asked to die for my faith. I'm told that, and in times you may be. I hope not. I'm kind of chicken sugar. Oh, I'm not afraid to be dead, because where I'm going, I'm just afraid to get there in certain ways. You know what I mean? But I'm asking you, what are the non-negotiable values that you won't compromise? And how do we deal with a system that's huge? Talk about that at your smaller sessions. What are the ethically relevant concepts that are absolutely transformational? For example, an ethically relevant concept to me, without quoting bioethical principles or looking in a textbook about the ethic of care, is shared decision-making. Come on back with me in the room. His name is Herbert. His bride wants one thing. He wants the other. I'm not putting my colleague who's a physician down, but he won't write a no CPR order. Those of you who are nurses in this room, what's hospital policy say? What's the real world say? They say, if you don't have a no CPR order, I'm supposed to resuscitate him even against his wishes. You know what? That is non-negotiable. So how would a new Millennium nurse deal with it? I'll tell you how we dealt with it in the 60s and 70s, which is before you were born, which kind of ticks me off, but I'll let that go. We'd walk, come on, slow code. You know what? It's ethically unacceptable. That's not part of your profession, no matter who you are. So I've learned to cope with those kinds of distressing things and learn to be straightforward, although I get myself in a whole lot of trouble around this thing called the ethic of care. Herbert, in my professional experience as a nurse of 35 years, in my humble opinion, sir, you are at risk. Why, Herbert? Because you want one thing, and some other people with a little bit more power see another ethically relevant concept is the nature of power. When you're involved in a ministry, the nature of power isn't an ethical issue the same way it is if you don't know you're in a ministry and your gift is service. Ethically relevant concepts, without referring to one bioethical principle. That's all I really would love to talk to you about at lunch. Oh, and if I'm going to say what's the ethic of care and what's the ethic of cure and how do you compare and contrast them, I can show you at end of life. The goals that are appropriate for people are not always the goals of cure. To preserve, protect, and promote life, to restore and rehabilitate. What if we can preserve, protect, and promote your life because of all our wonderful technology, but you don't want it, and it really isn't going to offer you rehabilitation or help you achieve life goals, then what is my ethic? The ethic of care often trumps the ethic of cure. But what a physician often does at that point in my practice is call me and say, Diann, what do I owe Herbert? He has the right to refuse treatment, any and all treatment, even the treatment that will cost him his life, even the treatment that will ask him to die differently, as long as he's competent and his refusal doesn't put an unfair burden on the rest of us. But I can't get the physician to write a no CPR order. I'm not being rude. If I could criticize the janitor, trust me, I would. But it's not the janitor who writes those orders. See, power when you're in a ministry versus power when you don't know a thing about the ethic of care is a whole different ballgame. We're talking about ethically relevant concepts and considerations. Words are very powerful. Have you noticed how we've kind of waffled and switched things? They tell me I have to call people customers. My attitude is I'm very comfortable in the intensive care environment. Maybe not this afternoon with my mother-in-law, but in general, that's my home. It's my background. And they tell me this is a customer. Words are very powerful when you talk about the ethic of care. The customer isn't always right, although that's a business model. Oh, and the word customer, my attitude is, this person's on the other end of an endotracheal tube. This ain't Macy's. He's not here by choice. I mean, there's a lot of things going on with my mother-in-law, and she isn't there because she wants to be. She ain't no customer. Patient, Ed Pellegrino taught me. He said, the word patient, Diann, comes from Latin. I never had Latin. Ed did. He said, the word patient, sweetheart, means one who suffers. And when you have a mindset around the ethic of care, and you're looking at another human being that is the image of the Creator, that's why we have respect for people, because people are made in the image of God, not just because they have the mere ability to procreate. But a lot of people that don't know about the ethic of care and what real ministry is about don't have that mindset. They see people as customers, and they do not see people as people who suffer. Oh, if I came into your home, as I did earlier this week, and her name is Denise. She's 47 years old, and she's got MS, really bad. She's got a son, first year in college. He doesn't want to see his mama die. The son who just graduated says, I understand, Mom, that you don't want to go on the ventilator. Her husband understands also, but a practical person, whether that's a pastor or a physician or a nurse in home care, would say, Denise, sweetheart, the closer you move to your dying, the more difficult you are going to experience this thing called breathing. And you know what? If I don't talk to her about the use of 911, see, you're on an ethics committee, then teach your community to give people another number other than 911 to call. Because you know what? They're panicked at that point. Do you remember when some of you heard the death rattle the very first time? That was a patient, not just a consumer. We have a covenant with people. That's what the ethic of care is about. And the very first time the family hears that stuff, they panic. Oh, the other time they panic, in my humble experience, is when, in fact, they stop eating and drinking and they say, come on, Mom, just take a little more. And when people stop eating and drinking, the ethic of care kind of kicks in, and people want to force. What does it mean to have respect for a person at the end of their life? I don't know about you, but I try to paint very vivid stories, and I try to tell people, if you call 911, there's only one ethic, and it won't look like the ethic of care. My daughter happens to be a cardiac physiologist, has a couple of master's degrees, and they tell me she's very good with people. I tell her it's genetic. No. And I know that basically when she rode an ambulance to make some money for her degrees, that she got a call one time and the lady was waving around an advance directive. What would the ethic of care demand? See, we haven't cleaned up those kinds of issues. See, it's nice to talk about the ethic of care and what we're called to be and who people really are and what their values are, but you know, unless you have a whole team that's going to honor and respect those concepts, really bad things happen to nice people. She said, Mama, did I do the right thing? See, she got there and he had stopped breathing and stopped beating, and she put him on the floor. Why? The couch is a lousy place to give CPR. She put him on the floor. And the lady, older woman, said, don't do this. He has an advance directive. What would the ethic of care demand? Sometimes the ethic of cure and the ethic of care collide head on in any given situation. What is your covenant with that person? People like Ira Bioethics and a lot of other people are talking about what are some ways we can empower the community because we're clear on our gift of service to people and the ethic of care. I talk to people in very common sense ways, and I say, you know, ethics is an everyday thing. You don't need a PhD from Georgetown. Oh, and ethics is just like a lighthouse. I like using metaphors, and I'm a boater, and I like taking pictures. Sometimes the lighthouse is a long way off, and sometimes it's right up front and personal. But every single one of us has an innate beacon. Now, some people will call it a conscience. Some people will call it the voice of God. Some people will say, hey, listen, it's just something intuitively. I know that's right. But you know, as Christians, we need to be clear on what our mission is and what our values are and what the ethic of care is about. If Herbert says, I've had enough, you got to know some bioethical principles, but the minute I start talking bioethical principles, people get really bored, turned off. Isn't she beautiful? She's our next door neighbor's dog. She's passed on. But the bottom line is, when I talk ethical principles, it doesn't seem to be enough. Why? Old-fashioned medical ethics says, hey, listen, appeal to the highest principle. All right? Quality of life versus the duty to preserve and protect and promote life. Those were the essential conflicts with Herbert. His bride wanted everything done. He said, no, I don't want that. What's the ethic of care demand? It's a very different approach than looking at principle-based ethics. See, that is my precious Herbert. With his permission, I get to photograph people, and he has since died, but the manner in which people who were non-believers ushered that man into eternity is enough to make any of us bold in our witness and passionate about the ethic of care. My faith teaches me I am accountable for things I do and things I fail to do. And in the name of the ethic of care, I've been asked to do some rather obscene things. So I'm going to ask you in the safety of a classroom, how would you define the ethic of care in your own practice when in fact there's a system that sometimes throws us out of balance very, very quickly? I hope you memorize his face. He was a sweet and gentle man. He said, sweetheart, when my time comes, let it come. I've had enough. And you know, we should have honored that. How long is long enough in a code? Haven't you ever wrestled with that? Sure you have. As a pastor, you have. You've wrestled with it as a medical social worker, a nutritional support person, physician, or a nurse. So I'd ask you to do more reading about this concept called the ethic of care, because there are times where they are very defining moments, and we are asked to stand up. Some people do it in a square in China. Some people do it by saying, hi, I'm not going to sit in the back of the bus because it's not right. See, some things are very legal, but they're not the ethic of care, and we need strong voices around those issues. So whether I'm in a PEDS oncology unit, I try to, with the students on rounds, talk about the ethic of care. See, the primary concept involved in the ethic of care is respect for individuals. Why? Respect because they're people? No, because they're made in the image of God. And in serving that person, I serve the Lord. Ultimate respect. Sometimes that's a tall order. The ethic of care does not quote bioethical principles. It looks more like the notion of we try to encourage people to stay communicating and to enhance connectedness, as the literature says. You know what? It's no difficult thing to get people to talk when they like each other. Have you ever noticed that? It's not a difficult thing when people are open and when they're attentive one another and they're responsive to one another and they're sensitive to each other's values. But it's an absolute art form to get people who don't agree to keep talking. That's part of the ethic of care. Oh, and it's a very different notion. See, 51% of the population happen to be female, and they walk through ethical dilemmas very differently than men do. I'm not slamming the genders or pitting them opposite. I'm just saying, when you study the ethic of care as much as you probably have, you know that men and women think differently. And the ethic of care is an attempt to say, look, let's not look at ethical principles, let's look at a different conceptual framework. My job is to enhance communication. But you know what happens in reality? Directly proportional to how far they fly in from out of town is how aggressive they want the life support. Have you ever noticed that? It's called moral anguish, and it's more than a textbook term. And I'm sure some of you have written articles on it. I just know how to say it in common sense. But I lovingly am to be that person's advocate and say, Connie, I know you and your brother don't agree, and you want one thing and your brother wants the other. But Connie, what makes the decision good and right is what your dad would have us do. That is the ethic of care. That's a very different notion. Very different notion. Oh, and I could show you that the ethic of care in the literature focuses primarily on the nature of the relationship you build with someone else, not on quoting ethical principles and appealing to the highest principle. The cardinal feature is we look at the nature of relationships, it goes beyond principles, and we say the most important quality in the relationship is that we have an obligation to honor people and to benefit them more than burden them. Why? Because we're not in a contractual relationship with people, we're in a covenant relationship, and we're supposed to make decisions based on my values, right? And forget yours? Is that who you want? It's how the world practices. That is not the ethic of care. Oh, and you can go on more in the literature and see that the ethic of care takes an awful lot of time to look at the nature of character and integrity. And there are certain core values that we affirm as Christians, and the ethic of care very definitely affirms in lots of different expressions in the literature. Ministering to people from a holistic perspective. I can show you plenty of people that talk very comfortably about physical, emotional, intellectual, social needs, but spiritual needs, all of a sudden, they ignore it. Why? They're uncomfortable with it. I can see nursing diagnoses, but I often challenge my students, say, where are the spiritual diagnoses? When someone says in a neonatal intensive care unit, why my baby? Don't you tell me that's a loving God. What do you say to them? Because the God I serve could heal that child in a heartbeat. And there are often times I want to do lunch with the Lord. I'd like to do lunch with you too, but I really want to do lunch with the Lord. And I want to sit down and say, gee whiz, you know, why can't you really honor us as Christians? And when we ask you to do something, I told you I was a neophyte. But that God I serve can heal that baby in a minute. And when that father says, what did my son ever do to deserve this? It hurts. And the ethic of care says, you come alongside, sometimes in absolute silence. Don't be afraid of that. I can tell you who's dying on the units. We don't make rounds on them anymore. Is that the ethic of care? Come on, talk to me. I'm not being rude. I'm just saying it takes a lot of courage to minister to people when they face their own mortality or someone they love's mortality. And the ethic of care says, I'm supposed to be centered on their values. Well, here's the real deal. The mother wants one thing, the father wants the other. And the baby has no voice, and there are special ways of relating to people in those situations. Some of the most powerful things you can ever know is simply be present to people in their anguish. We abandon our dying. We abandon our elderly. We kind of warehouse people that have certain challenges in their life so we don't have to see them every day in the grocery store. And when our children ask, do we answer from an ethic of care perspective, or do we just sort of shuttle them embarrassingly past that individual, maybe known as Joni Eareckson Tada? Some of you know me well in this room know I had a broken neck. For a former Olympic athlete, that was pretty hard to take. I was very vain about my ability. I thought if I just disciplined myself enough, I could be the best in the world. And the Lord honored that in many ways. The very first thing a physician ever said to me is, "You will never walk again." That was really very inspiring. It was. I'm not yanking your chain. See, I'm the kind of person, if you tell me no, and Chris Hook has told me, "Sweetheart, you are a willful woman. You need to give that over to the Lord." And Chris, even though I haven't seen you recently, I've really given so much more over that, and I got a long way to go. Thank you as a brother for reminding me. But he was actually very inspiring. It was the ethic of care. He said, "You will never do this." And I said, "Oh, now watch me." But who do you give the praise to? The athlete that healed or the Lord that healed her? See, the ethic of care demands us as Christians, in everything we do, to honor the Lord first and to give credit where credit is due. When I was running around this morning, literally, I was outside. I'd burn off nervous energy by going for a run, and it wasn't even really fully light out, and I was just really full of this one song, which I will not sing because I have a terrible voice. This is the day that the Lord has made. We will rejoice and be glad in it. And I hope you join in prayer with me, because the ethic of care would demand that I share that with my mother-in-law, even though she gets angry whenever I talk about the Lord. But this is the day where healing will take place. And I said, "You know, Emma, healing has more to do than physical things. For the first time in a long time, you're going to relearn that your family loves you." It's a terrible way to relearn it, but you're going to relearn that we're coming in from all over the country just to be with you, to give you confidence and a hope. Where do you draw your hope from? Do you testify to that hope? That's part of that ethic of care. From a Christian perspective, it's very different from what the world offers. And the ethic of care, as you look in the literature in greater detail than we're doing, balances this imbalanced notion of concentrating on principles all the time. The ethic of care also says one of the hallmarks of thinking from a care-based perspective is that you ask very different questions. I got taught at Georgetown that the nature of the questions you raise really can shape the whole ethical debate. See, what do I owe this individual? What are my responsibilities? How do I honor her? And basically, how ought, ethically, I respond? The ethic of care also says to me, is what I'm doing honoring to this person? Is it compassionate? Is it respectful? Is it my will or somebody else's will? Is what I'm doing loving? Kindness. I'm called to practice loving kindness. And you know what? I don't like all my patients. Can I admit that to you? I don't like all of them. When I see a young woman using crack cocaine during a pregnancy, I don't like what I see. But you know what I've learned as a Christian? That I can separate differently from how nursing taught me to do it. I can separate not liking what she does versus still honoring and loving her. Maybe there's a real reason she has turned to that substance. I was on rounds the other day. The other day for me could be a metaphor. My husband and I teach together a lot, and he says, "Sweetheart, the other day," that was 7 years ago. Time flies when you're having fun. But the other day we were on rounds, and one of the medical students said, as he was giving a report on the patient, "She's a frequent flyer." You know what? I'm a frequent flyer. I have over 100,000 miles on one airline, and it allows me to upgrade for about $20. It's a deal. She's a frequent flyer. And I thought, I wonder what he means by that. This is a young, impressionable medical person. Do you think he knows about covenant and the ethic of care? I'm not criticizing. I'm just saying, I noticed it. I kept my mouth shut. You would have been proud of me. And he went on and gave the rest of his report, and he's young in his walk. That's all. Doesn't mean he's not gifted. He just didn't seem to understand the nature of the relationship, and the nature of his own character would influence everything he would say and do about that woman that morning. We walked in the room, 9 white-coated professionals gathered around the bedside and talked right over the patient. Have you ever done that? No, of course not. You're a Christian. I have. And I'm ashamed of it. And I try not to do it. I'm sure I still do, but I sure try to call people to accountability on that. 9 people talking over this woman. Or we call them bed number whatever, and we forget that these are real human beings. You know, he had a great life before, and she had a great life before, and you happen to present this way. You're only seeing a slice in time. Frequent flyer. And I couldn't help but notice her face. See, the ethic of care demands sensitivity. The highest moral sign of competency you can have is sensitivity. So I tell all my students, the most important thing you can ever have as a physician, a nurse, pastoral caregiver, is a heart for people, sensitivity. Why? You can't call yourself good if you keep walking on by. And if you ever never noticed the person that was beaten by the side of the road, then you can't take any effective ethical action without sensitivity and a heart and love for people. I don't know about you, but what would it have meant for my students in that morning to be ethically competent? Sensitivity would have meant they wouldn't have called her a freaking flyer. I noticed tears in her eyes. I don't know about you, but it always compels me when people cry. And it compels me more when certain genders cry versus other genders because we give people different permission. Not really, I'm just kind of kidding. But she was crying. And I know her name. And yet we're going about our rounds and ignoring her. What would the ethic of care demand? Is what I'm doing loving, kind, compassionate? See, this isn't PhD ethics here. This is everyday ethics. I said to the students, hold off, just a minute, time out. If it's good enough for people in baseball, it must be good enough for us. Hold on a minute, do you notice anything here? See, noticing and sensitivity are the hallmarks of an ethically competent individual. It's not a tall order, but you'd be surprised how many people are not ethically competent. See, if we had longer, I'd ask you to get in small groups and talk about ethical competency. And it would net a lot of data. I said to the students, what do you see? And they were kind of shuffling around, a little bit embarrassed. And I said, Susan, good morning. My name is Diann. May I call you Susan? I have no right. I'm a total stranger. You have no reason, Susan, to trust me. I happen to be a nurse. And I can't help but notice this morning that there are tears in your eyes, and I have no idea why those tears are in your eyes. That's the ethic of care. Noticing, giving it a voice, and asking people, may I come alongside? See, the gift of presence, one of the most important things is asking permission. If we had longer, I'd get to the slides on presence, and I do have them. But presence is by invitation. She was crying. There was no invitation there. We had hurt her, was my fantasy, but I wanted to check it out because you really shouldn't project your own stuff on other people. I said, Susan, can you tell me the first time you ever sought comfort and peace in a bottle rather than in a relationship with somebody else? It was just a wild guess. I think it's called discernment. You've been in practice a long time. The ethic of care demands discernment. Is what we're doing loving kindness? And basically, when you have the gift of the ethic of care, and you talk about care-based ethics, it's a different notion than talking bioethical principles. Here's the story she shared. And Robert Veach wrote this story. She was basically a woman who had 2 kids, 2 little boys, a couple of years apart, and had a great marriage, a nice husband, and I guess one day a lot of things turned around. I guess the older little boy was racing up and down the sand dunes, and the little boy was chasing him, and basically one got up to the top, the stronger and the quicker and the faster, and then he started running down, the little guy's up top, and he watched his brother be buried alive by a sand truck that came and just kind of dumped the sand in the wrong spot. He witnessed the death of his brother. It hurt. Susan told us that, in fact, that boy never got over it. He had real psychiatric issues. How do you help a child turn grief into good grief? That is part of the ethic of care. She said her husband is his way of coping. I'm not saying he's a bad man. I'm saying as his way of coping, he left. He couldn't take it anymore. Judge not. She's a frequent flyer. I was stunned. Tell me that's a covenant relationship. Oh, and when she told us that she started drinking shortly thereafter and has not stopped since, picture of a woman with cirrhosis became a very different moral picture. And the picture of the woman behind me is a real woman too. She wouldn't consent to brain surgery. She said, you know what? I know it's crowding me. 37-year-old female neurosurgeon. Hey, the way a 37-year-old looks at life and an 81-year-old looks at life are two different things. I'm experiencing that in a very real way with my mother-in-law. She's 77. I happen to be 53. And in fact, she's looking at life very differently. And I've noticed as an ethicist that the closer people come to the end of their life, sometimes age has nothing to do with it at all, but I won't go there any further. I'm just saying, she said no. What part of no don't we understand? So we faxed her daughter. Her daughter and she had no significant relationship. Al Johnson would call that contextual features. And her patient preferences, as Al would say, is something about, look, 37-year-old neurosurgeon tells me I might not be able to speak, I might not maintain consciousness, and guess what? I don't want you to do this. Shrink it, doc, if you'd like, not the treatment of choice. Poison it if you'd like, doc, not the treatment of choice. Treatment of choice is to cut it out. She said, guess what? You can't do this. I've been a Brown University professor all my life. We honor her so much at Brown, she's called Professor Emeritus. She has a lot to say. She said, you know what? I don't want you to do this. So we faxed her daughter and sent her to surgery, kicking and screaming against her wishes. Come on, talk to me. What is the ethic of care? I probably could have done a lot better job if I had focused on the real literature on the ethic of care and talked about proactive focus and really talked about the theoretical framework. But my attitude is people that are much brighter than I'd ever hoped to be have articulated those things beautifully in the literature. And I'm told as a teacher that if you tell stories, people don't forget the stories and they relate to them, more importantly than the data. So as we end, and I'm going to switch the slide tray, I want to remind you that if we have an attitude that people are just to be fixed and repaired and we do what we want, and when we don't honor who they are and really operate out of an ethic of care, you find out very quickly you're out of balance and you cause an awful lot of harm. And above all, we're not supposed to be harmful to people. We're supposed to minister to them based on their values, unless there's some other compelling, ethically relevant feature to that. My time has been necessarily short because there are a lot of people to talk with. But I want to close by sharing with you a song that a nurse wrote who's a wonderful colleague of mine. She's strong in the Lord. Her name is Bonnie Wazorek. She's able to write in gifted ways, and she has a best friend named Diann Penning, and Diann sings beautifully. I'd like to think that I'm getting better at my photography, so what I'd suggest is as you hear the words of the song and see the patients that maybe I've ministered to, but you have too in the same way, as we close, it would be an effective way to remind us about the ethic of care.
Where did you learn the things you know? How is it your smile can cheer my soul? When did you come to be so wise with such compassion in your eyes? did you learn all these things? How did you learn all these things? Tell me, where did you learn all of these things? You seem to know the words I need to hear, and other times you simply lend an ear. I find your strength in each gentle touch. Where did you learn so much? Tell me, where did you learn the things you know? How is it your smile can cheer my soul? When did you come to be so wise, with such compassion in your eyes? When did you learn all these things? How did you learn all these things? Tell me, where did you learn these things?
Isn't that a beautiful, beautiful song? The world needs to know the difference between covenant and contract, and the notion of keeping care as a central theme, as opposed to maybe some other core values that seem to be explicated more frequently and with more power. And people need loving kindness and the gift of presence. My hope is that the way in which I've presented some of this information, which is probably very different than what you're used to, has been useful to you and effective to you, that it's honored you in your practice, and it's called all of us to accountability as witnesses for the Lord. My hope is, as I said before, that you give Jesus Christ a magnificent reputation through your gift of service and through your life. And I really say in honesty, I'd covet your prayers, and I hope to be with you again next year and learn with you and talk with you and grow with you. God bless you for what you do, and Godspeed. Thank you.